Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Living with and overcoming any type of chronic health condition can require substantial physical as well as psychological resilience. And over time, this has a tendency to deplete one's emotional reserves. Struggling with pain and the eternal quest for pain control can leave most people feeling exhausted and depressed. And when this continues month after month and year after year, it can feel like the very life force is being drained from your body. A key part of our job as professionals who treat people with pain is to facilitate and rebuild this sense of resilience. Resilience is defined as one's ability to adapt and function well despite significant psychological as well as physical stress or distress. And this quality is associated with a shift toward healthier behaviors and more vital living. Resilience factors have gained increased attention in the field of chronic disease management as key mechanisms in the relationship between symptoms and disability, using interventions that cultivate mindfulness, involving acceptance, values-based living, the ability to distance from one's thoughts and emotions, a non-judgment of present moment experiences, and the ability to contact a new sense of self have all emerged from the evolution of traditional cognitive behavioral therapy. Acceptance and commitment therapy, also said as one word, ACT, is one method you can use to cultivate resilience and promote health behavior change. And this is achieved through the training of one core psychological process called psychological flexibility. On today's episode, you'll hear from practitioners from around the globe who are using ACT in research and practice to help people overcome persistent pain. We begin with the originator of ACT, Dr. Stephen Hayes.
ACT methods help people actually engage in needed exposure when they sort of see that there's something there. After all, at some level, as you begin to expand your life out, you're going to expose yourself to new situations. And so, like, if you've been engaging in very defensive behavior just physically with regard to your pain, and you may have a provider saying, well, look, dude, that's actually predicts long-term problems, but those kinds of physical avoidance patterns or defensive bodily things, at times those things can actually exacerbate an injury, make it more difficult to do the physical things that might help you be more flexible and effective just physically. And so, if you're going to change your life, you're going to hit some of those places where you're afraid. Am I going to feel it again? Am I going to injure it again? Well, ACT will give you some of those skills to help you enter into needed exposure in a way that's emotionally and cognitively open. The other thing is that it'll give you kind of a values-based reason to do it at all, which helps you persist and walk through. But another one is this broader, more open attentional process can help us square this circle, which is on the one hand, you may be being asked to walk into exposure. On the other hand, you're being asked to still respond to your body and not push yourself beyond a safe limit. And that's very tricky when you're dealing with something physical, something like chronic pain. And so the experience of being able to be more open, to be able to read your body in a little more open way, to be able to read this present moment, I think can be supported by the practices that allow us to get into this kind of more mindful or wowful, to go back to what I said earlier, mode of mind. So we do have data that people are more likely to persist if it's values-based and accepting, and they're more likely to try in the first place, and that they're more able to sort of stay within self-limits.
Up next is psychologist Robin Walzer.
Whatever is happening for the individual, I want to do exposure work, willingness work in such a way that I'm more interested in some ways in the bodily experience of it than I am what's happening in their head. I mean, of course, I'm going to look at that too, but I want to get them fully present to all the experiences that they're having in their body, becoming aware of them, changing the perspective on it so they can see it as an experience that they're having, watching its rise and fall, noticing its intensity and quality and how it shifts as they continue to observe it. And essentially, we're creating new learning here, right? Is that they learn that these experiences are not dangerous, that they're safe even if those experiences arise, and that they can be with and hold these experiences without the need to avoid and move away from things that they care about in their lives. I also want to say we do look at thoughts, right? But we're seeing them for what they are, thoughts, and we're having people take perspective on thinking, seeing mind as a learning critter that doesn't unlearn. We can't unlearn. It just learns, and it adds to learning. And so what I'm hoping that folks will be able to see is that they can observe the ongoing process of thinking, and they don't have to get all entangled in what their mind is saying about them as a result of the trauma. Just like I would if working with someone with chronic pain, like your mind is going to say things like, I can't do it, or this is impossible, or how can I go on like this? Sort of pulling people away, as with trauma, from what they care about and what matters to them and meaning in life. And so diffusing from disentangling people from their mind in ways that help them to step forward in meaningful, values-based engagement in the service of vitality rather than in the service of happiness. Now, some people might think that's an odd thing to say, right? Like, what, you don't want people to be happy? Of course I do. But we don't walk around happy. Happiness isn't a permanent state. And there's shows that if you are trying to suppress pain, you're trying to eliminate and get rid of emotional pain, that we're not very good at targeting that single emotion and saying, I just want that one to go away so I can have all the others. Mm-hmm. Indeed, if you try to push one down, you push them all down. And so if you're not willing to have emotional pain, you're also not going to have joy. Like, you cut joy off as well. If you open yourself up to experiencing, you're available in the moment for pain or joy, whichever one is there.
That was great. And now we'll hear from psychologist Ashlyn Mullen.
So we tried to find postures that reflected certain ACT processes. For example, acceptance. What we had them do is think of it something that they're struggling with and try and hold it in goddess pose, which is like this and kind of like a squat, and notice what's showing up for you as you hold it, and to sit with it as long as you can. And then to go to star pose, which is like completely out, and going back and forth. And what is it like to hold these struggles while in these different postures? So that was something, I mean, really, we just made it up. We were just trying to think, like, what movement do we feel embodies acceptance? So that was one example. And also yoga has a lot of mindfulness in it. So the mindfulness piece that we used was like 3-part breathing, or Durga breathing, where you use the 3 chambers and really controlling your breath. For the values, instead of using values, we use mantra, like finding your mantra. What's something that you can tell yourself to give you comfort, and setting an intention, which was like committed action and intention towards that mantra.
And now over to physiotherapist Mary Grant.
So, yeah, I mean, living well with pain is a really difficult concept, isn't it, for all of us, really, patients and clinicians. I mean, it doesn't sound right, living well with pain. So it's a tough one. I think the first step is to acknowledge the patient's journey to date and, what they've tried already to get rid of pain and how this has worked or maybe not worked for them. Then what I love about ACT is using metaphors like storytelling to try and maybe help the patient to see that maybe there are other ways around this, that maybe it's okay to drop the whole trying to control the pain or get rid of the pain agenda, because that can be really hard for people, because of course that's what they want to do. Yeah. So I think that has to be, you have to kind of go carefully with that with people. And then the next thing, I suppose, once you've kind of got that suggestion out there that maybe controlling the pain is not maybe the most beneficial way to go, maybe they're ready to try something new. And that's where I think clarifying what values are for them as humans, like what they care about most and who they care about most in their lives. So them as people. And that's, I think, the next big thing that can really help them to kind of go on the path towards going back to what they want to do or be. It's different.
And let's hear from psychologist Lillian Dindo.
It's not disease focused. It's not disorder focused. It's strength focused. We're trying to build on their strengths and to help them develop resilience. So The term psychological flexibility is too jargony, I think, for the community, but resilience is a term people get. And in a way, psychological flexibility is resilient. So I will say things like we help people develop greater resilience by actually really connecting to the kind of life that would honor the things that they've been through. You know, like how do you live a life that honors the people you've lost along the way? What do you think you would tell, or what do you think a fallen soldier would want? How do you think they would want you to live your life right now? Do you think they would want you to withdraw? And what would it look like to turn a page so that you're not rereading the same chapter of your book, that you're now opening up a new book? And we give you the skills to do that, you know, and we help you kind of recognize what are some of the challenges and what are some of the behaviors that feel really good in the moment, but actually lead to really long-term negative impacts. So I don't think I've gotten really good, Joe, at describing it just very briefly. But they get the values piece, you know, they get the acceptance piece. And I say, like, our brain doesn't work by subtraction. I don't ask my veterans to try to change their memories or change their experiences. I try to help them build on those experiences.
And up next is physical therapist Mary Doyle.
I found it really a change for me to go from that instructor mode. I'm the one that knows stuff. Let me enlighten you. If you know this stuff, you're going to get better. Sometimes it would work. Sometimes it would be okay and they would be absorbing it. But a lot of times they wouldn't. And so we'd just be at the same place. Okay, let me tell you about it again. Let me tell you a different way. Let me use this instead. And they still just wouldn't get it because I'm still on the other side telling them what to do, telling them what to think, or telling them how they should be thinking. That's where ACT really helps. And it's allowing them to get that confidence up that they can help themselves. That's so hard because they walk into the clinic and they expect you to fix them. They expect to be better walking out, but they have a super mistrust of the whole medical system, of anything coming from the Department of Corrections. And so if you're not saying exactly what here, they're not going to listen. And then they're not going to do the things that they need to do in order to get better. They have to be able to think of it themselves. I have to be able to guide them so that they can get there.
And then it's physiotherapist Davide Lanfranco.
Thought suppression is about anything but allowing the thought to be there. So distracting yourself, watching the movies, putting the music on, trying to think positively. That belongs to this very toxic messages that are delivered by the society, you know, think positive, positive thoughts, positive vibes. Just put away everything that is scary, negative, and it is not nice, and just replace it and change it with positive stuff. And these toxic messages leads us to the understanding that negative thoughts, scary thoughts, anxious thoughts are wrong, and that must be pushed away. And when you push them away, you get the ironical effect. They come back with even more, even stronger. And research, in fact, has shown us that suppressed thoughts are characterized by increased return of the suppressed content. And you may be familiar with the polar bear experiment done, I don't remember in which year, in which they ask people, they show people a polar bear, and then they told them to try to not think about the polar bear. And it was impossible. So when we tell our patients, and it's something I hear very often from my colleagues during the year, saying to the patients, you know, trying to be positive, things will be all right, don't think too much about it, don't stress too much. Thank you. If she or he could have done it, he would have done it already. You don't need to tell the person, think positive, or don't stress about it, or don't worry. So acceptance commitment therapy and cognitive diffusion actually teaches us how to do this from another perspective and how to take a step back. So I think that cognitive diffusion is something very powerful, but as we said before, people who have a high level of cognitive fusion don't even recognize they're having thoughts in the first instance. So they think that is the truth. You know, I have a bad back. That is the truth. It's not even a thought that is passing through my mind. They think that is the truth. So before going and using fancy techniques and very nice techniques that acceptance commitment therapy offers, I think the first step with these patients is helping them being more aware of their cognition.
And now we'll hear from psychologist Lance McCracken.
For any individual that we see, we're going to have outcomes of interest. And in pain management, we have some conventional ones like pain interference or disability or depression or pain intensity. And that what we'll have is we'll have a range of variables that we know are correlated with those. Presumption is if you manipulate that correlated variable, it'll impact on your outcome of interest. And so if you then add to that, we've said another thing, which is these links are very individual. They're based on a person's learning history and their situation. And then if you add a couple other features to their individual and you say they may be bidirectional, the relationships between these process type variables and outcomes go in both directions. They're dynamic. They change during the course of treatment. They may go back and forth, the strength, or they may strengthen in their impact or lessen in their impact. So saying these few things, they're multivariate, bidirectional, dynamic, and individual. And they are the kind of things that we've just said. And they are things like something about catastrophizing, for example, something about avoidance, probably by the same token, something about behavioral engagement or behavioral activation. I'd say there's going to be an attentional sort of process domain we probably need to nail down, something about awareness and attention. Yeah, we don't have that many more. I mean, so ACT is based on a psychological flexibility 6-facet or 3-dimension open, aware, and engaged model. I think people interested in psychological flexibility and ACT will see evidence for these facets, but not everyone would agree with that. And so you have to begin to ask questions about what's enough evidence to call something an evidence-based process. But that's a little bit all over the place. But you see what I mean. I mean, there's probably some that look pretty strong. Most people would agree. But I think we're still populating this space of evidence-based processes.
And then it's over to physiotherapist Tom Young.
I think some of what we do more traditionally, there's something kind of seductively complex about it.
That's true.
Kind of thing, all the kind of like regional interdependent models. I'm going to watch you walk and you've got shoulder pain. Okay, well, your ankle's pronating 10 degrees. And if we fix that, I think just accepting that maybe that A doesn't have the best evidence to begin with and B but letting go of that sense of, maybe I'm not quite as clever as I think I am. And that's actually a challenge. I think you kind of acknowledge your own, sense of intellectual vanity almost, and kind of letting go of that a little bit can be a challenge. And again, sort of answering what you expect a patient needs. So when maybe you encourage a patient to do something and in the session they really buy in and they're like, yeah, this is so important to me. This is awesome. And then they have a really big pain flare. And then there's that sense of you can either swoop back in and try and save the day and say, here's what we're going to do. We're going to control this and back off. I think that robs people of agency. So I think, again, part of that is just trying to model a boldness about pain and sort of, okay, you had pain, but what else came up for you? Was there some excitement when you did that thing? Was there some joy in the moment? What else was there room for in that moment? And I think the more I've done, the less of a kind of win-loss there is as a kind of frame for me. And I think that's kind of what's freeing. So I think trying to fix chronic pain is kind of like banging your head against a wall. And I talk a lot about patients letting go of that fight, but me as a practitioner also has to do that. If I'm still sort of secretly like, but all of this is to really make you have less painful experience, then I keep on kind of feeling that loss. And that's not a battle I'm winning. So I think to truly sort of let go of that control for myself as well and be willing to model a boldness again about pain is quite liberating too. And just always bring it back to, okay, that happened, but what else? What's important to you?
If you're a practitioner and you're interested in learning more about mindfulness and acceptance-based approaches for chronic pain, as well as other chronic lifestyle-related conditions, make sure to check out our resources over at the Integrative Pain Science Institute.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit integrativepainscienceinstitute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.